Okay, let's talk about acid-base relationships for a little bit. We're going to go over some facts about acid-base relationships, but I'm also going to teach you a principle, okay? And I want you to think of this principle as you're using your critical thinking for answering acid-base relationship questions. Now imagine, if you will, that you're in a classroom with all of your classmates, and I were to ask you, how many of you, raise your hand, if you can name 10 signs and symptoms of metabolic alkalosis, metabolic acidosis, respiratory acidosis, and respiratory alkalosis? How many hands do you think would go up in your classroom? Well, I'm going to teach you a technique that will allow you to deduce and whip off a list of 10 or 15, maybe even 20 different signs and symptoms that you could expect to see in a patient with any one of those metabolic derangements, and you will be far ahead of any one of your classmates who doesn't have this technique. All right, so listen up, you're going to find this handy. Well, the first thing you need to know when you're thinking about acid-base relationships is you need to know two lab values. So the two lab values that you need to know are for your normal range for pH and the normal bicarbonate range. And the normal pH for the body is 7.35 to 7.45. And the normal bicarbonate range is 22 to 26. Now, you need to understand that those are coming from an arterial blood gas, from an ABG. All right, so if you get your labs back, say you have like regular morning labs on a patient and you're looking at the normal bicarbonate, remember that's coming from a venous sample, not from an arterial sample. So venous, you don't have to write this down, but venous bicarbonate is 22 to 32. So it's a little bit tighter range for the arterial range for bicarbonate, which is 22 to 26. Okay, so when you're interpreting any sort of arterial blood gas to determine if your patient is in metabolic acidosis or alkalosis or in respiratory acidosis or alkalosis, you want to look at the pH and the bicarb. Now, there's techniques that you can use that are more advanced and will tell you if it's partially compensated or fully compensated, and where at some point in your career you may need to know that. If you end up working in an ICU, it's going to be helpful. And at that point you can learn that. But for what you need to know for the NCLEX, you only need to know two lab values. Now on the NCLEX, they're going to give you a bunch of lab values. Right? They're not just going to give you the two that you need. But you just need to throw away all the information except for the pH and except for the bicarb levels. And what you want to look at is whether the bicarbonate and pH level are normal, or whether they are elevated, or whether they are low. So if they're both elevated, they're both in the same direction, or if they're both low, then they're in the same direction. But they could be in opposite directions also. So when you're interpreting, this is the very top sentence: if the pH and the bicarb are in the same direction, then it's metabolic. Okay, so if the pH and the bicarb are going in the same direction, then it's metabolic. So I want you to draw an arrow. When you are taking the NCLEX, you'll have a little whiteboard that you can write on, a dry erase board. And so write down the pH range, or write down the pH and write down the bicarb, and then put an arrow. If it's elevated, put it up. If it's low, put a down arrow. And if it's within range, just put a dash. Okay, so if both arrows are going in the same direction, then you know it's metabolic. Right. Then, if the arrows are going in different directions, or if you have one arrow and then one dash, so one's in normal range and one is elevated or depressed, then they're not going in the same direction. So they're either both in the same direction or they're not. And the two that aren't are either going to be their opposite directions, or one is normal and one is elevated or depressed. So if they're going different directions, then you know it's going to be respiratory. So if the pH and the bicarb are in opposite directions or not in the same direction, then it's respiratory. So let's look at some examples. The pH of 7.57 and bicarbonate of 31. So you look at the ranges there, and those are both elevated. So draw a little arrow next to each of those. And draw the arrows on the NCLEX, all right? Use that whiteboard that's given to you for a reason. That is part of your toolkit for taking the NCLEX. So you draw the arrows, both of which will be elevated, And so in the first blank, I want you to write the word metabolic, because if the pH and the bicarb are in the same direction, then it's metabolic. And then the second bit of information that you need to look at is the pH range. And that's going to tell you if they're alkalotic or acidotic. And when you look at the pH range, if the pH is above 7.4, then it's going to be alkalotic. And if it's below 7.4, then you know that they're acidotic. Because remember, the lower the pH, the more acidotic they are. Okay, so a pH of 1 is more acidotic than a pH of 4. Okay, so why 7.4? Well, that's the midpoint range between 7.35 and 7.45. So in this situation, the first one, or example there, you look at the pH, 7.57. Is that elevated? Yes. So because the pH is high, that means that they are alkalotic. And so this patient is in metabolic alkalosis. So alkalosis goes in that second line. Now, let's look at the second patient. Has a pH of 7.31 and a bicarb of 20. Okay, so draw your arrows. 7.31 is low, and bicarb of 20 is low. This patient is in metabolic acidosis, right? And we know they're acidotic because we look at the pH, and 7.31 is below the midpoint of our range. Okay, so what happens when we go to this next patient? pH of 7.21, bicarb of 29. Okay, so 7.21 is low, and 7.29 is high, so they're not in the same direction. So if the pH and the bicarb are not in the same direction, then we know it's going to be respiratory. And then we need to look at the pH to determine if it's acidotic or alkalotic. And the pH is low. So the lower the pH, the more acidotic they are. So this patient is in respiratory acidosis. And then the next patient here, pH 7.49 is high, and a bicarbonate of 21 is low. So figure this one out. They're opposite directions, so you know it's going to be respiratory. And then the pH is high, so the higher the pH, the more alkalotic they are. So this patient is in respiratory alkalosis. Now, when you start talking about compensation, how do you know if it's compensated or not? So if the bicarbonate is out of range, but the pH is normal, in the normal range, then this patient is compensated, okay? You don't need to know if it's partially or fully or whatever for the NCLEX. You don't need to know that in that level of depth. But if the bicarb's out of range and the pH is normal, it's compensated. Now, the challenge comes when we're using the pH. If it's high or low, how do you figure out if it's metabolic or alkalotic? Well, the pH never compensates past the midpoint of a range, okay? So the pH, if it started off high and then is now normal, it's not going to compensate past the midpoint of the range. So if it's 7.4 to 7.45, you knew that it was high and it came down into the normal range, so that would make it alkalotic, right? And if the pH started off low and they were acidotic and it came up into the normal range, so if the bicarbonate is out and the pH is in range and it's between 7.35 and 7.4, then you know that it's acidotic. Okay, so remember, if the bicarb is out of range but the pH is normal, then the condition is compensated. And the pH never compensates past the midpoint of the range. So then you can go back to the examples we did. If the bicarb is high and the pH is in the low half of the range, then you know that they're opposite, so you know it's going to be respiratory. And if it's in the low half of the range, then it's going to have to be acidotic. So it's compensated respiratory acidosis. Okay. Another thing that they may ask you to figure out on the NCLEX is to identify some signs and symptoms of a patient who is in respiratory or metabolic acidosis or alkalosis. So how do you know if the patient's pH is high or low? Well, you can look at their lab values, right? But you might not have lab values. If you didn't just get a set of ABGs on a patient or to your blood gases on a patient, how might you be able to recognize this? What would you be looking for or considering in your patient if you saw some sort of clinical manifestation of a acid-base relationship that's out of balance? Well, the signs and symptoms of these situations follow a rule. And the rule has one exception, but the rule is that as the pH goes, so does the PT. The PT is the patient, right? So as the pH goes, so does the PT, except for potassium. Okay, so potassium is inversely related to pH. So in this little T column here, where I have acidosis equals pH, I want you to draw a down arrow, so pH that's low, and alkalosis equals a pH, and I want you to draw an up arrow. So if the pH is high, then the patient is alkalotic. Now, what does it down mean? What does the down arrow mean? What does the up arrow mean? Well, the down arrow indicates that the patient will be experiencing things that are lowered in the body. And if they're alkalotic, they're going to be experiencing things that are going to be elevated in the body. So if we look at two situations, say diarrhea and constipation, which one is an elevation and which one would be considered a depression, right? Which one is overexcited and which one's underexcited? So the overexcited one is going to be the diarrhea. And if your bowels are underexcited, then you're going to have constipation. So you could write down constipation under acidosis because the down arrow indicates that it is depressed. And then under alkalosis, you could write diarrhea. Okay. And we're going to talk about a very important concept here in a little bit, but these are just kind of some general indicators that, or signs and symptoms of acidosis or alkalosis. So let's go down the left-hand column. What are some things, physical manifestations that a patient may have that are indicating a depression in the body? Okay. So you could write down things like, would you write down hypotension or hypertension, right? So you'd write down hypotension, things like lethargy, disorientation, decreased deep tendon reflexes, anorexia, bradycardia. You don't have to write all these down, but I want you to just look at the pattern and look at the concept as a whole, okay? Decreased urinary output, we talked about constipation. So those are all things that are lowered in the body. Now, up there next to those couple little stars at the top, I want you to, that table, we have an exception, right? So the exception is the pH. So if a lowered pH has the opposite effect on potassium, you know that they are going to be hyperkalemic. Everything else is hypo, but for potassium, for kalemia, it's hyper. So go ahead and write the other exception on the other side of that column. So if the pH is high, you're going to have hypokalemia. Okay, that's the opposite. That's the exception. So as the pH goes, so does the PT, except for potassium. So for the rest of signs and symptoms for alkalosis, because the arrow goes up and it represents an elevation, what other things physical manifestations would indicate to you that there was an elevation? So anything that has the word hyper, right? So hypertension. You could have things like anxiety or clonus or tetany, tachycardia, cardiac arrest, diarrhea. Those are all things that indicate an elevation in the body. And we know that when the pH goes up, so does the excitability in the body. When the pH goes down, the excitability level in the body also goes down. So when you're studying for the NCLEX on whether it's a drug, whether it's on some disease condition or progression, I want you to think about what does this condition do to the body. Okay, so for this example, in acid-base relationships, when the pH goes down, the body goes down, except for potassium, which goes up. And when the pH goes high, you want to think the body goes high, except for potassium, which goes down. Now, how do we think about this on the NCLEX? It's important on the NCLEX to use this information as the basis for your critical thinking. So if I were to ask you, which patient should you have on seizure precautions? The patient with metabolic acidosis or in respiratory alkalosis? Right? Well, we know that the patient in acidosis is going to have a depression and everything, so they're not likely going to need to be on seizure precautions. But what about our patient who's alkalotic and has a high pH? Absolutely. We're going to want to have them on seizure precautions. Okay. Which patient should we be most concerned about falls with? The person who's excitable and bouncing around, or the person who is lethargic and, having a depression in all of the systems in their body. I'm going to watch the one who is more lethargic. Which patient should you have an ambu bag ready? Right? So the patient who is having hypotension and, decreased respiratory effort, or the patient who is excitable and has hypertension. Right? Well, I think the person who's going to go into respiratory distress is probably the person who is experiencing a low pH. So you could see how on the NCLEX, they could ask you a bunch of different questions, and you can use the information that you've just learned as the basis for that. Now, back to that situation that I described in the beginning of this lecture about how many of your classmates, or yourself included, could name 10 signs and symptoms of these different metabolic derangements. Well, do you think that you could confidently answer that on the NCLEX? I would hope so, and if you can't, then just go ahead and listen to this lecture again. It's about 15 minutes of information up to this point, so re-listen to it if you're not fully grasping this concept, and you should be able to answer. A multiple choice question should be pretty easy for you, and at this point, you should be excited if you get a select all that apply question about acid-base relationships, because you should be able to go down the list of 8 things or 5 things or 10 things that they give you as options and ask yourself, is this an elevation or is it a depression? And then you're going to select the things that are appropriate based on the patient's pH. All right? So, what causes these imbalances? Okay. Now, what you can do is ask yourself, is it lung? Okay, is it a lung-related issue? Okay, so if it's yes, then it's going to be a respiratory-related issue. And if it's not lung-related, then it's going to be metabolic-related. So if it has to do with pneumonia, okay, or atelectasis, does that have to do with respiratory? Yeah, okay. Now, when it is respiratory, so is it lung? Yes, equals respiratory. So if there is overventilation causes alkalosis, and underventilation causes acidosis. So remember, when we're breathing, we're blowing off hydrogen. Okay, and hydrogen in your body, when it binds to other molecules, is acidic. Okay, so as you blow off hydrogen, you're blowing off acidity. So if you're not ventilating well, the acid is building up. That's why low ventilation causes acidosis. Okay, now, on the other side, when you ask yourself, is it lung related? And you say no, it's going to be metabolic. Right? And then you need to ask yourself a second question. Is there prolonged gastric suctioning or vomiting? And why does that matter? Right? Well, what's going on in your stomach? Your stomach is producing acid. So if you're vomiting, is that acid staying in your body or is it going out? Same thing with prolonged gastric suctioning. So if the answer to that question is yes, there is prolonged gastric suctioning or vomiting, then there's less acid, so that's going to cause alkalosis. And if there is not, then it's going to cause acidosis. And at the bottom there, circle that where it says, whenever in doubt, pick metabolic acidosis. Okay? If you just had to guess, if I didn't teach you anything and you don't, from this lecture, and you remember one thing, and you got to the NCLEX and you had no idea any of these rules, when in doubt, pick metabolic acidosis. And remember, the NCLEX is a vocabulary exam as much as anything else. So for Kushmal respirations, Okay. When do we see Kussmaul respirations? Well, Kussmaul respirations are deep and labored, kind of gasping breathing that you typically see in patients with DKA, diabetic ketoacidosis, or in renal failure. Okay. So these are patients who are not able to excrete the acidity on their own, and so they are trying to get it out as hard as possible through their lungs. Okay, so that's why they're breathing deeply and it's labored and they're gasping because they're just trying to get rid of that and just trying to blow off that acid. So Kussmaul, a great memorization strategy that someone taught me about this is to think about, for Kussmaul, think Mac Kussmaul. Okay, Mac Kussmaul is a crazy Scotsman, they say, and Mac Kussmaul it should be the way that you think of it from now on. Don't ever think of Kussmaul respirations. People think you should be thinking somebody has Mac Kussmaul respirations. Well, what does the Mac stand for? Mac stands for metabolic acidosis. So if they're having Kussmaul respirations, they are in metabolic acidosis. Okay? Now, let's go back real quick. I told you that there's something really important that you need to understand about the NCLEX and about causes versus caused. So, when you're answering a question on the NCLEX, you need to fully understand, what are they asking? Are they asking what causes something, or what did that something cause? Okay, so deep, heavy, labored breathing, as in Mac Kussmaul respirations, what causes that kind of breathing? Okay, well, metabolic acidosis causes Mac Kussmaul respirations. Okay, but what if you have a patient who has a stable pH and then starts overusing, say you have a question asks you about a mother who is overusing their breathing techniques during labor. Well, that mother likely started off with a normal pH, okay? And so now they're over-breathing, okay? So now they're breathing deep and heavy, and they're blowing off more hydrogen, okay? So they're blowing off acid. They're going to become alkalotic. So acidosis causes overbreathing, but overbreathing causes alkalosis. Okay? So you need to understand, are they asking you what causes something or what does something cause? So for example, if you have a patient who has a normal pH and they get diarrhea, say they get norovirus and they get diarrhea, they go on a cruise, okay? Careful on a cruise, always wash your hands. Now, you have a normal patient who gets diarrhea. Diarrhea makes the body lose bicarbonate, so it will cause you to become acidotic. But if that normal patient started to, before getting diarrhea, started to become alkalotic, the body is going to say, hey, I can get rid of some of that bicarbonate and bring down the pH by giving the body diarrhea. So in this case, alkalosis causes diarrhea, but diarrhea in a normal patient causes acidosis. Okay, so that's why you need to be careful with what are they asking on the NCLEX, because we said that alkalosis represents hyperactivity in things, which is where we put the diarrhea. But if they say you have a regular patient who gets diarrhea and they ask you what metabolic condition do you expect to result in our normal pH patient, they're going to end up being acidotic, even though we already said that diarrhea is associated with alkalosis. Okay, so they may be already in an alkalotic state, which caused the diarrhea, or they could be in a normal state with having diarrhea that was caused by something else and become acidotic. Okay, so remember, on the NCLEX, ask yourself, are they asking you what causes something, or are they asking you what does that something cause in the body? All right, very important first starting point. So at this point, you know everything that you need to know about acid-base relationships for the NCLEX. And really, unless you're working in an ICU or some specialized setting, maybe like the emergency room, you are going to be able to use this to dominate anything that you come across on a regular nursing unit. I have nurses come to me all the time and ask me, hey, what does this ABG mean? I don't know how to interpret these results. Okay, real quick, you look at two things. pH, the bicarbonate. If they're both in the same direction, then you know it's metabolic. If they're in opposite directions, then you know that it's a respiratory issue. Okay, so there you go. Keep studying hard. Remember, think about what does this condition do to my body, and you're going to do well.